Vanakkam, I am Dr. Karthika. As an intern, you are sitting in the OP and a patient comes to you with complaints of palpitation. So what would you do now? If a patient comes to us with complaints of palpitation, the first thing that should come to our mind is rhythm. That is, if he is feeling his heartbeat regularly or irregularly. But how could you know that the patient is feeling his heartbeat regularly or irregularly? Just ask the patient to tap on the table according to the rhythm he feels. That is tap 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 like that. If you think the rhythm is irregular, what might be the causes for his palpitations? Look to that whether it is irregularly irregular or regularly irregular. If it is irregularly irregular, it may be due to atrial fibrillation. Or if it is due to regularly irregular, it may be due to ectopics like premature ventricular contractions or premature atrial contractions. So in these cases, ECG and echo will be helpful to us, and in ectopics, alternate low volume and high volume pulse will be there. And electrophysiologic studies will be helpful for us to know any aberrant pathways causing arrhythmias or palpitations. This is first part. Next, if the patient feels regular palpitations, what might be the causes? First thing what should you do is check for his pulse. If the pulse is more than 120 per minute, that is if the patient has tachycardia, what will be the causes for his palpitations? It may be due to supraventricular tachycardia or ventricular tachycardia or due to rheumatic heart disease or thyrotoxicosis. Now, how will you rule out all these things? For SVT, VT and RHD, ECG and echo will be useful for us. And also look for murmurs, for example, if he has RHD. And for thyrotoxicosis, tell the patient to swallow, look for thyroid gland, palpate for thyroid gland, look for any eye signs or tremors. Next, if the patient's pulse is less than 120 per minute, what might be the causes for his palpitations? So, first thing may be due to sinus tachycardia. Second, anemic. So, ask history about any tiredness or bloodness he feels after work or exertion and look for paleness while examination. Third, anxiety. Most of the cases for palpitations will be due to anxiety. So, ask does anything bothers him or he is anxious about anything. Next, hyperthyroid pregnancy states may cause palpitations, or valvular heart diseases or left ventricular hypertrophy may cause palpitations. So on examination, look for apex beat, any parasternal heave like that. If he has left ventricular hypertrophy, his palpitations may be throughout the day. Then importantly, if he is a diabetic patient, hypoglycemic attacks may cause palpitations. So think of his sugar level. And then hypertensive patients may also have palpitations, so check for his BP. Then medications may cause palpitations as side effects. For example, vasodilators, anticholinergics, sympathomimetics. So ask about his drug history. Then if the patient has habits like nicotine, caffeine, alcohol, smoking intake, then they may also cause palpitations. So ask about his personal history. And then if the patient's pulse was even below 60, his palpitations may be due to sinus bradycardia or advanced AV nodal block. In these cases also ECG will be helpful. You have evaluated everything and you have come to a conclusion that everything is normal, then we can give him tranquilizers and beta blockers because most of the cases of palpitations will be due to anxiety. So we can give him Alprax and propranolol 10 mg TDS for few days. And also counseling regarding avoidance of alcohol, smoking, caffeine, nicotine like that. If the patient's palpitations got settled, then okay, no problem. But if the patient's palpitation has not settled, then we have to evaluate further. So how could we evaluate further? For ruling out anemia, we should take HB. And for thyroid functions, we should take T3, T4 and TSH. For any cardiac lesions, we should take ECG, X-ray for cardiomegaly and echo. So from this, we can come to a conclusion why he has palpitations. Hope this was useful. Thank you.